Hello, good evening, Nigerians and our viewers around the world. You are welcome to Talking Health with Dr. Laz, your favorite health program on television. We're reaching you from your channel of choice, the Africa Independent Television, AIT. My name is Dr. Laz Eze. Antibiotics is one of the drugs that is most abused, not only in Nigeria, but in Africa and many other parts of the world. Of course, do you know that antibiotics is not a treatment for many causes of cough and catarrh? Do you know that antibiotics is not over-the-counter drug? It's a drug that you need doctor's medication to buy. So many things you need to know today on this program. And I have an expert in this area who is going to be speaking to it. She's a pharmacist. She has extensive experience on matters that have to do with antimicrobial resistance. But I'm going to be introducing her further after the break. So please join us on our social media handles displayed on your screen at Talk Health Nigeria, and also subscribe to our YouTube channel so that you can always watch the program even after the live broadcast. Please stay with us. Let's go on break and we'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Here with me in the studio is Estella Onyekachi Mbadiwe. She's a pharmacist. She is also the founding partner of Ducid Blue Solutions and also a former senior special assistant on health to the former governor of Imo State, Emeki Hedioha. You're welcome to the program.
Thank you very much, sir.
Yes. I know this is a topic that you very much love to talk about. Yeah. Every year you normally participate actively. But before we begin to the don'ts, perhaps you explain to our viewers what antibiotics are and what they are used for.
Okay. Thank you so much, Dr. Laz. Amazing to be here.
Welcome.
So yes, antibiotics are drugs used for treating infections caused by bacteria specifically. So I think we need to be clear that, like you said in your intro, that they're not for flu and some common cold. So they're drugs used to treat bacterial infections. So they're used for infection. They have a lot of uses. They're very useful for modern medicine. Mm-hmm. We can't have a lot of options for treatment today, if not for the discovery of antibiotics many moons ago. So yes, so they're amazing drug. They're great for modern medicine. And it's something that we have access to, we're privileged to have access to, so we need to manage them very carefully to make sure that we don't lose the opportunity to continue using them.
Right. Every antibiotic has a duration for use.
Yes.
But some persons get to stop before they use. So what do you have to say to that?
Yes, so thank you, because yes, every treatment has a duration. So even amongst the drug, you have different duration depending on what infection is being treated. So the best thing is to work with your doctor, work with your pharmacist to get the guidance of what the information is, what they want you to do in terms of how to use it. So people that stop before, this contributes to resistance, because once you stop, the bacteria become resistant. And it's very important to know that it's the bacteria that becomes resistant, not the human being. So we really need to be very careful, because what we do impact other people and has impact on the ability for other people to use the drugs when they need it. Yeah.
Okay, so there's a slide we are going to share on the screen that will make you understand better some of these points, why we continue to speak to them. Yes, thanks for making our time to prepare the slide. You could see different types of antibiotics, and you test before you treat. So, and that's the reason for culture. That is usually requested when you go to see a doctor. They ask that you do some culture tests to know the specific antibiotics. Never share an antibiotic. What do you have to say to that?
Yes, because sometimes they prescribe antibiotics, they get the prescription, and because, like you mentioned earlier, they don't finish their course, and they keep this doses at home, and then when someone else gets sick, they assume it's the same thing, and then they share the drugs within the family with friends. So we really recommend not to share antibiotics, because we have to make sure it's prescribed for you for what indication that is being used for.
Okay, trying to make it simpler is if you are using an antibiotic, antibiotics medication, and it's remaining, it's not if someone else have an illness, you say, okay, take this one I used and continue to use it. That's what you mean, not to share.
Exactly.
Right. We'll also move to the abuse now. I believe that we've gotten some understanding. We need to spend a lot of time on the abuse for people to know what it means. But what does it mean really?
To keep it really simple, abuse, we've said these drugs are amazing. They've helped us to be able to treat so many infections. And we're really, fortunate to have access to antibiotics. So to keep it really simple, abuse is abnormal use. So anything that is abused, there's a use for it. When it's used abnormally, when it's used outside the recommended use, it becomes abuse. So even if an antibiotic is used for, it's being used for a specific infection, but then next time you think you have the same infection, or you think someone has the same infection, and you use it for that, what you presume it is using it abnormally. If you use it for what indication is not meant for, that's abnormal use.
Okay,
so that's abuse.
In that case, if someone has pneumonia and is prescribed a particular antibiotics, and someone else gets to use that antibiotics for urinary tract infection, which it might not be effective against, is an abuse.
Yes, so you're using it outside the normal use.
Yes.
Yes.
And also, if someone is supposed to use it for 5 days or 1 week, and the person uses it for 3 days, it's an abuse.
Exactly.
Or the person is supposed to use it for 7 days, and he now use it for 10 days, it's also an abuse.
Yes.
Okay.
Yes.
So I think that makes it very clear. We'll now move to antibiotics resistance, and it will also be shown on your screen in the next slide, where you have, you could see that a picture of someone that is just taking so many, and you see some are round, some are cylindrical in shape, different colors. It's just a pictorial representation of different sorts of antibiotics someone is taking. So this resistance, how does it happen, Onyi?
Yes, so resistance is a natural process. It happens naturally. Resistance will happen naturally.
What does it really mean?
So what it means, thank you. So what it means is that the drugs are no longer working like they normally would.
Okay.
So basically, you have an antibiotic that is prescribed for, like you mentioned, pneumonia or urine infection. And then you find that when you take the same antibiotic, it's no longer working like it should.
Yes.
So the bacteria has become resistant, because it's sort of said, it's saying that, okay, for example, if you take it, if you abuse it, don't finish the course, then the bad bacteria, the resistant bacteria would then survive beyond that time that you didn't finish your medication. So if 5 days is meant to kill all the bacteria, and you stop earlier, some of them will survive, and they then become resistant. So they won't work with that antibiotic like it's supposed to.
So if someone is supposed to take antibiotics for 5 days or 7 days, and you took it for 4 days, it will kill some of them. Some will survive. Those ones that are surviving may have produced something they used to resist the effect of the antibiotics in them.
Yes.
Right.
So it's a natural process. It happens naturally. So what we're trying to avoid is the likelihood of it happening as much as possible due to abuse, due to incorrect use. Yes. Okay,
what's the implication when that happens a lot?
The implication is that we then don't have access to these drugs. The normal things we do, if you think of antibiotics use, it's used in so many parts of medicine, from surgery to newborn babies that are not well, to infections when someone has a wound. So it means that we don't have those antibiotics to use.
So it will no longer be working.
It won't be working. So we have a big global health, global problem that, like you mentioned, is not just in Nigeria, it's not just in this locality. Because it's the bacteria that is resistant, it travels.
Yes.
So it has a global problem. It's a very significant global health security problem.
Okay, so I think the next slide gives a better picture on that's how the causes of antibiotics resistance. You also see that on your screen. So overprescribing of antibiotics could lead to patients not finishing their treatment, and overuse of antibiotics in livestock and fish farming.
Yes. Please
speak to that.
Okay, so it's antibiotic resistant. It's not just a health issue. It's called One Health. And what One Health means is that it impacts on human health, it impacts on animal health, and it impacts on environmental health. So what happens is that because antibiotics are used in farming, sometimes it's abused. So
what do they use it for in farming?
So sometimes they use it, some people use it as a growth promoter. Some people use it to prevent infections that are not there. So what happens is that those antibiotics in the animals, when they're resistant, we ingest that meat, and then those resistant bacteria
we get into our system.
Yes. So it becomes a big problem. So globally, a lot of antibiotics, in some countries, up to 80% of the antibiotic use is actually in animal farming,
Wow.
So it's quite significant. So we need to take this as a holistic issue, which is what we're doing in Nigeria. And the Nigeria Center for Disease Control and other stakeholders are working on this as a One Health issue.
Okay, that's really a good point. We're going to get data around this antibiotic resistance, but that will be after the break. We speak more to this and, of course, round up the program. So do stay with us and we'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I've been speaking with Onyeka Mbadiwe. She's a pharmacist and also a former senior special assistant on health in Imo State. Yes, before the break, we were talking about the processes of the resistance, but let's look at the numbers now, the global burden of this antibiotics resistance and the implication it has for us here in Nigeria. So you see that on the screen. Yes, Onyi, can you speak to this? So many numbers and maps all over the place.
Yes.
So perhaps you take it from the Africa and we bring it down to Nigeria.
Okay. So what we're saying, these numbers is just a snapshot of what the reality is. We need to work with data. We need to work with what the numbers are telling us and use it to manage the crisis of antibiotic resistance. So what this number is just showing is showing 10 million deaths annually from antibiotic. This is the projection of how many people are going to die from this issue if we don't do something about it. By 2050, annually, there will be approximately 10 million deaths. So we're saying it's going to cost approximately 66 trillion pounds. And this data is from a commission by the UK government on antibiotic resistance. So what we're saying in terms of Africa, this means from that 10 million, what this projects is that about 4.1 million is going to impact Africa. Of course, Nigeria being the biggest country in Africa, we're going to potentially take the biggest chunk of that. So we're saying in comparison, antibiotic resistance is seen as a hidden pandemic. It's a big problem. So we need to work with the data more.
Almost like 8 times that of COVID, potentially, if we don't do something serious about it.
The impact is huge. So we need to look at the data, look at data in Africa, and use the data to respond to how we address this challenge.
Yes, we are going to also be seeing the side effects of some antibiotics in the next slides. I may give a warning that the picture might not be very pleasant, but I think, yes, you've seen the side effect of cotrimoxazole, right? Generally known as Septrin. Yeah. So kindly speak to what we're seeing. That looks like Stevens-Johnson syndrome.
Yes, sir. So that's Stevens-Johnson syndrome. This is a case. I'm sure some people may have seen this picture in the past. So the patient was given, she bought from a chemist some Septrin at the time. And, basically, Stevens-Johnson syndrome is a very serious side effect. It's not very common, but, it can have this level of disastrous consequences. So it
appears as generalized body rashes with some scales and...
Exactly. So it starts normally with, flu-like symptoms with some rashes, but with this case, from my understanding of this case, the patient went back to the chemist that she bought the drugs, and because they did not understand what was happening, they gave her the drug to continue taking the drug, as far as I understand. So normally, when this happens, you need to immediately stop the drug, which wasn't done. So the patient then had a very serious significant side effect. It became, her skin surfaces, it looked like she was burnt. And, this is really the extreme level of this. And the patient unfortunately died. So it's quite a serious side effect.
Yes, we have other pictures of Stevens-Johnson syndrome, but they're looking very gory that we may not want to show them on TV. But if you want to see more of those kind of pictures, do a search online and you could see a lot of that, but that's one of it. But there's also another common antibiotics that we use often, amoxicillin,
Yes.
and there's a potential side effect to that. You know, we'll see the next slide on the screen. The side effect, the rashes that could occur from amoxicillin. So you may want to also speak to that.
Yeah, so I think what we're trying to do is just create awareness. You know, these drugs are amazing. We want them, we want to use them, but we need to educate people so that when these things happen, there's things you can do, there's a way to manage it, and so it doesn't repeat itself. So this rash is just showing, this is a potential side effect from amoxicillin. It's a well-known side effect. So with these patients, we should document that they've had this reaction so that they don't have a repeat of it. And it's very, very important. So the rash is generalized and it can be quite serious. So, again, education and awareness, working with the right healthcare professionals to get the right information is very critical.
As she explained, is generalized rash, whether irrespective of what your skin looks like, and it can occur between 3 to 10 days.
It can, but it can also start immediately. I've seen patients where it started immediately.
Okay.
Yes.
So there is also another common class of the aminoglycosides of antibiotics, like the gentamicin, tobramycin, amikacin, and all of that. Would you want to speak to, because these are commonly used drugs, especially for patients that undergo surgeries and other these things. Those common side effects that could give.
Again, these drugs are very, very useful drugs, but they have you have to dose it very carefully. And, again, this is why you need the healthcare team, the multidisciplinary team working. As a pharmacist, I had to dose patients, calculate it with their body weight, very important, and work with the team and the doctors to say, this is what we want to do. So some of the side effects that can happen with there is something called ototoxicity with the gentamicin. So this drug, it means that the ear...
Let's break it down.
Exactly.
Right.
I was going to say, so ototoxicity is basically you have a side effect where you have...
it's toxic to the ear.
It's toxic to the ear.
So it can actually affect hearing.
Exactly.
It can cause hearing impairment.
And it can actually be permanent. The damage can be permanent. So we really need to be careful. So some of these side effects are avoidable with the right management. Like I said, these doses have to be dosed with the specialist knowledge. As a pharmacist, I definitely worked with the multidisciplinary team to work on this. And we want them to use the drug. And because we're aware of what the potential side effects, we monitor the patient very carefully, ensure they have enough fluids, etc. So, again, it just brings it back to working with the medical team. To guide with the use of this drug. So we don't want to scare people.
Yes.
That's
why we say is side effect, because like in the previous program we had, I did mention that every drug is a potential poison.
For sure.
Note, potential.
Potential.
So when it's properly used, it works magic. But when it's abused, it can actually be very harmful. And aminoglycoside can also cause kidney damage, the nephrotoxicity aspect, which it might heal and it might also become something very chronic. There's another antibiotics. Our time is going very fast. So from the health system's perspective, how do we fix this problem in terms of people knowing who to contact, where to go? We've talked about some of these side effects of antibiotic abuse. So how do we get solutions to it? Looking at it from the primary healthcare, secondary, tertiary level.
Yes. So I think we need to have those pharmacovigilance systems and those medicines information centers or contact information set up. I think we can have it, either we have it at the tertiary level or the secondary general hospital level, and then there can be a referral process. If there's capacity to have something at the ward level, the local government level, so that they have, because you have medical practitioners working at that level as well. So they can be a contact person to sort of guide that process.
Do you think it might be more efficient to have instead of having at every small level, perhaps within a particular unit or a local government or a community, have a centralized and have a referral pathway to getting solutions? Of course, with availability of ambulance services and transportation means to get, help patients. But what of the use of technology? Any use of that in this kind of scenario?
Definitely. So, the medicines information centers, you could have it as, like you said, like a hub and spoke, so that they have the technology, because even, you know, in my practice in the UK, you don't have that level of expertise at all the levels. You have a big center that is sort of a, you know, hub and spoke system. So the use of technology, definitely, you can use it to even view patients, have, you know, do
like
assessments of patients, like telemedicine, yes.
solutions.
If those options are available, you can even take pictures of the patient.
Of course, they
and
are
send
currently
it back.
not available, but
Yes,
that's what
that's
some
your
of the
building
recommendations
towards.
that.
Yes. And NAFDAC, I worked on a project for the primary health centers, developing the essential drug management for the primary health care centers. And NAFDAC has options for those reporting to happen at that level. And you can send it to them. NAFDAC is actually very involved in that.
Oh, they are very well. Is there a number that you called and NAFDAC?
There's a contact number that the facility staff have, and also then the patient, when they report it, they fill the form. So there's a yellow form that is a reporting form for such incidents, and then they send it back to NAFDAC to manage the incidents. Okay,
that sounds great. Thank you very much, Onyeka Mbadiwe.
Thank you.
I think anyone watching this would have seen that we've done justice to this topic. I wish we could have a number, just as you have the 112 emergency line, you know, where people could call instead of having multiple numbers to report these kind of issues.
I don't have the number on me, but NAFDAC has something for a reporting that patients can report directly. I unfortunately don't have the number on me right now, but we can share that information.
We'll get the NAFDAC people in subsequent programs to you know, enlighten Nigerians further on this. That's the much we can take today on this program. I've been speaking with a pharmacist and founding partner for Ducid Blue Solutions, and we've been discussing about antibiotics, the uses, the abuse, the implications for the abuse, and as well as the solutions, how we can make our system to prevent all this. Thank you for being with us, and keep watching us every Tuesday on this same station. But don't forget to contact us through our social media platforms, ask questions, and also make your own contributions, as well as follow us on Talk Health Nigeria TV on YouTube, where you subscribe so that you always get to watch our videos as at when due. My name is Dr. Laz Eze. Bye for now.